Hello folks, in this video we are going to discuss types of outcomes after treatment with surgery of macular holes. There are three main types of outcomes: visual acuity, the closure rate, and the microstructure of the retina. Let's talk about visual acuity. Visual acuity improvement after macular hole surgery will depend a lot on several factors: the duration of symptoms, but mainly if the hole closed or not. Also, some types of holes like myopic or traumatic will experience lesser visual improvement after surgery. The duration of the symptoms and duration of the hole is very important because chronic macular holes may close but the visual improvement is not so great. The size of the hole is also important since the photoreceptor structure will influence the visual acuity improvement. Therefore, in conclusion, about visual acuity, improvement of visual acuity after macular hole will depend on several factors and varies a lot from patient to patient. The second outcome is the closure rate. In the beginning, in the 90s, closure rates after macular hole surgery used to be very low, around 50 to 70%. Nowadays, for idiopathic primary macular holes, closure rates are over 90 or even 95% with one surgery. However, some situations will generate a lower closure rate, like larger rows or chronic holes. The closure rate will also depend on the technique. If transplant is performed for larger holes or giant holes, the closure rate will be greater than a simpler technique because the size of the hole will not enable its closure. So, in summary, closure of the macular hole will depend on a few factors, but mainly on the size of the hole and on the technique. A third very important type of outcome is the microstructure of the retina, especially the outer retina or the photoreceptors. If the photoreceptors are intact and working, patient will experience visual improvement. So when the macular hole closes, you want to examine the structure of the outer nuclear layer and the outer retina layers, like the ISOS junction, the cos line, or interdigitation zone. So in summary, when you see a patient with a macular hole, you want to think about three types of outcomes: vision, closure, and the structure of the retina. And try to adapt your technique and the expectations of the patient on those three variables. See you on the next video. Thank you.